Hello, my name is Jemiah Coulter, and I am a public health graduate student at East Texas A&M University. I am excited to present my work on the impact of chlamydia on women's reproductive health. This is something that I have been working on for a couple of months. And today I'll be sharing the rationale behind this program, the key data, the proposed interventions, and how we plan to evaluate its effectiveness. So here will be the video link that I will attach and send after the conclusion of this presentation if you would like to send this to anyone. So let's get started. Why chlamydia? Chlamydia is a common yet serious STI that is particularly affecting young women. It often goes undiagnosed because it doesn't show any symptoms, which makes it a significant public health issue. In Texas, the rates are especially high, which is why a targeted intervention is necessary. Here we have our first visual, and this shows rates at a national, state, and local level. As you can see in the chart, that chlamydia rates are much more higher in Texas and Dallas County compared to our national average. And this highlights the urgent need for focused prevention efforts in these areas, particularly again among young women. So, our health overview. Chlamydia can cause serious health issues like pelvic inflammatory disease, and this affects a woman's fertility. It also poses risks during pregnancy. These complications underscore the importance of prevention and treatment, especially considering the barriers women in Texas face, such as the stigma and limited access to care. Here we have another visual, which is our health belief model. And this helps us to understand why individuals might or might not engage in preventative health behaviors. For example, chlamydia prevention, we apply this model to assess women's perceptions of their susceptibility to the infection, the severity of the consequences, and the benefits and barriers to prevention. Our program interventions. Our interventions focus on improving access to testing through pharmacy-based test to treat services. We'll also implement regular screening campaigns and provide education that will help induce the stigma and encouraging women to seek care without feeling ashamed and letting them know it's okay to get tested. It's okay to want to better your health and your well-being. So here we have another visual, and this is our logic model. Our logic model outlines the framework for our chlamydia prevention program. It starts with the inputs such as funding and partnerships and leads to activities like screenings and education campaigns. Ultimately, we expect these efforts to lead to the desired outcomes of improved access to care, like we discussed, increased awareness, and a reduction in chlamydia among women in Texas. Next, we have our evaluation plan. As you can see, we'll use data collection, surveys, and the tracking of STI rates. We'll focus on both process and outcome measures. And again, we'll track the number of women who participate in the screenings and educational programs. And we'll also measure the changes in chlamydia rates over time. Feedback from stakeholders like yourself and participants will be crucial and important to refining the program. So, in conclusion, Chlamydia is a serious public health issue, especially in Texas for our young women. Our program aims to increase access to care and reducing the stigma and providing crucial education to help prevent chlamydia. And we won't be able to do this alone. We need you. And collaboration with our stakeholders like yourself will be essential to our program success. I want to thank you all for watching, or if you would like to discuss the program further, please reach out to me. Here's my contact information. All the resources that were used to make this presentation possible are listed here. And again, if you have any questions, please feel free to contact me at the email address I've listed below. Thank you so much for watching. Bye-bye.